Last month, we introduced you to local Dr. Richard Busch and his Busch Chiropractic Center. In today's Medical Minute, we dig deeper into a treatment that he has created. Joining me now is Dr. Busch to tell us all about it. Okay, about 20 years ago, you began creating the DRS protocol.
Right.
I've seen commercials. I'm sure our viewers have seen commercials. Describe exactly what it is.
Well, DRS stands for decompression, reduction, and stabilization. And really, it's a group of different types of treatment methods that we've actually put together. Because one of the things, you asked earlier whether this was something that we created 20 years ago.
Right.
Well, it's actually been evolving over the course of the last 20 years. We started using this type of treatment technology at that point. And one of the things that we found is that by adding different types of therapies and that type of thing, we're able to actually even get better outcomes than we did initially when we even started using the treatment.
Okay, so in layman's terms, describe the process.
In layman's terms, we're using different types of treatment tables to actually pull the disc level apart, which helps us create a pressure gradient between inside and out. So we can actually bring more oxygen, water, nutrients, everything that disc needs inside the disc so it can heal. Okay, along with that, we're using some different therapy modalities that'll actually help calm down the muscles and cause cause a release in natural painkillers.
Give me an idea, let's say physically, what you would actually do.
Physically, you're actually harnessed, whether it's around your thoracic and spine and pelvis, or around your neck. It's very comfortable. It sounds a little bit different than that.
I was wondering, you're harnessed.
Most patients fall asleep during treatment. It is a very comfortable treatment. During the course of that, there's a 25-minute treatment period where we're actually applying a decompressive force to the spine. In layman's terms, we're usually adding about 50% of the patient's body weight plus or minus 20 pounds. In some cases, we go a little bit more than that. It's a very comfortable treatment for patients. They normally fall asleep during treatment. Along with that, then we also use some other therapy modalities just to help calm things down when we're all finished. Most patients actually may notice a little bit of soreness, kind of like they went to the gym for the first time during the first couple of treatments, but certainly no additional pain. Along with that, we are using some different nutritional recommendations that'll actually help decrease the amount of inflammation and inflammatory properties that they have in their own body, because we know what we eat is what we are. And along with that, then we have some other treatment recommendations, whether it's exercise or even some mental exercises where they're actually practicing from a visualization standpoint, those things that they want to do. Because really, if you can't see it in here, you're not going to see it out in the real world.
Right.
And so we're actually looking at all different aspects of the patient's response so that we can actually have the best possible responses from patients.
Which patients should get this type of treatment?
Well, patients anybody who has neck or back problems that hasn't responded to really conventional chiropractic care, or they may have had physical therapy and they didn't respond to that, if they've had a failed back or neck surgery, or if they're considering having a neck or back surgery, those are the patients that I really like to work with. They're patients that have been diagnosed with herniated or degenerative disc, maybe sciatic pain. The same thing goes for the cervical and lumbar spine.
We've got many weeks to talk about this. We can really go in depth with this, but Doctor, thanks for coming in. I'll see you soon.
Thank you so much, Sarah. I appreciate it.
You can find out more about the Busch Chiropractic Center by calling the number or going to the website that you see on your screen. You can watch the Medical Minute the second and third Mondays of every month during our noon newscast. Pat, back to you.